So, what is a concussion? A concussion is a mild traumatic brain injury. Um, it can occur after an impact to your head or after a whiplash type injury that causes your head and brain to shake quickly back and forth. A concussion can result in an altered mental state that may include becoming unconscious. But not every case of concussion does involve you losing consciousness. The people who are more at risk of obtaining a concussion are athletes while they are playing or practicing out there on the field. So after you get hit in your head and you start to suffer from symptoms such as complications of memory and concentration, irritability and other personality changes, sensitivity to light and noise, sleep disturbances, psychological problems, and signs of depression and disorders of taste and smell. Usually, when you notice these symptoms, you can pretty much self diagnose yourself of having a concussion. Although the symptoms may not show up immediately, these symptoms can last for days, weeks, or even longer. After sustaining so many concussions while playing sports, you can develop CTE. And what CTE is it's a progressive degenerative disease of the brain found in people with a history of repetitive brain trauma, often found in athletes. It includes symptomatic concussions as well as subconcussive hits to the head that do not cause symptoms. So, CTE is mainly found in athletes who play football, and as their career goes on, they're at a higher chance of getting CTE, but not many people know the true consequences of having CTE. And it is important to know that those who do have it, they do suffer from aggression problems, depression, anxiety, suicidal thoughts, and eventually they will have dementia. These players do their life expectancies are lowered because of CTE.
That's fine. I'm gonna run you over here. Go. Go.
So, what can be done to reduce concussions? So, preventing concussions is difficult to do. The referees can try and do as much as they can to protect these athletes out there, but they do happen naturally. But what we can do to reduce the amount of concussions in sports, football especially, is get doctors and players together to discuss what can be done to their helmets to try and protect their heads. And for example, in other sports where they do not use helmets, we can try and treat the injury as fast as possible, but it is hard to stop that due to the fact of these athletes competing at the highest level and being physical.